we are again, Lil-Lets Talk with myself, Dineo Ranaka. Brand new set. It looks amazing.
So beautiful.
It's stunning, right?
It's gorgeous.
I mean, we're on the set of where we shot our BU campaign. Our BU campaign is all about individualism, right?
Yes.
Our menstrual cycles are different. Our experiences are different. No 2 days in one cycle are the same. And it's important that we also get to know ourselves deeper so we make the right choices for our bodies and for ourselves as individuals.
Yep.
So welcome to it. I'm so excited to have you. Dr. Travill, hello there. How are ya?
Hi, I'm good, thanks. Thank you so much for having me here today.
Gogo,
Togos.
how are you?
I'm fine, thank you. And how are you?
I'm well. Are you feeling all right?
Yes, I am.
Pontsho?
Yeah, I'm great. I'm looking forward to this conversation. This is a topic that's very close to my heart and
Yeah.
the work that I do. So I think it's time we have this conversation.
I think it is. Let's get straight into this conversation. Subject at hand, let's deal it. Cervical cancer. Dr. Travill, I'm going to start with you on this one. Cervical cancer, what is it?
So cervical cancer, as the name suggests, is cancer of the cervix. And just to go, I think, a bit into the anatomy of the cervix. So the cervix is what is kind of typically called the mouth of the womb. It's the opening, it's the bottom part of the womb. And it plays although it's a really small organ, it plays a really important part in protecting the uterus from the outside world. It's the opening to the outside world. And it also plays a really important role in pregnancy and childbirth. The reason that it's such a risky spot for cancer is that it's an area of a lot of cell change. You've got quite a few cell types there that changes constantly through menstrual cycles and different hormonal levels. And so it's quite a easy target for cancer. Cervical cancer is one of the few cancers that we have a clear cause for. A majority of cervical cancer, over 90%, over 99%, is caused by a type of HPV, human papillomavirus.
Yeah. Now, Dr. Travill, I want to just quickly clear the link between HPV and cervical cancer.
The link between HPV and cervical cancer is quite a direct link. So HPV is the most common STI around the globe. It is incredibly common. Most women and most people will be infected within 3 years of their sexual debut.
Yeah.
It's not that more populations are more at risk for HPV.
Yeah.
It's incredibly common. And most people within 2 years will clear that infection. Their body will deal with it and kind of resolve the infection on their own. In fact, that's about 90%. So 90% of people with HPV, which is most people, will resolve that infection within 2 years.
Yeah.
A small portion of people will then progress on to form these precancerous lesions due to a persistent HPV infection. So a chronic HPV infection causes changes within the cells, and these precancerous lesions can also themselves resolve and will see no problems. A small group of people then from precancerous lesions will develop a cervical cancer from that. And so this kind of natural history of the disease is incredibly important to know because it gives us a good opportunity to work out what we can do in order to prevent cervical cancer.
Yeah. Pontsho, you are a journalist, a successful one at that. Congratulations on your
Thank
book
you.
Flow.
Thank you so much.
You wrote an article recently on cervical cancer. A very alarming stat that I found from that article was how breast cancer kills more white women than black women, and how cervical cancer kills more black women than white women.
Yeah.
This is very, very alarming because cervical cancer is preventable.
Yes, no, the statistic you're talking about is from the National Institute of Communicable Diseases, a research paper that was published in 2018. And the statistic is that black women are 6 times more likely, to die of cervical cancer than white women. And obviously, South Africa is a majority black country.
Of course.
So obviously there will be more incidences or more black women with the disease or any kind of disease, to be quite honest. However, with cervical cancer, from that research and from talking to experts, it's very clear that the cause here is the fact that the cervical cancer gets detected too late.
Why? Why is that, based on your research?
Screening. Pap smears
Are
are
we
not being done.
ignorant? Are we financially crippled? I mean, are we failed by the health system?
It's all of that.
Is it cultural? Is it traditional?
It's all of that. It's not one thing.
Let's pinpoint. Let's layer
Let's
it
start
out.
with the health system.
Yeah.
80% of South Africans use the public health system.
Yeah.
And that number increases as each year goes by. Because what happens, people on private medical aids run out of funds. So our health system is overburdened. What does that mean? It means that there's just not enough healthcare services for everyone at this point. And what happens is that we see certain areas, particularly sexual and reproductive health services, being underchanged. They're not at they're not at the optimal best as they would be. I'll give you an example. A couple of years ago, the province Mpumalanga did not even have a single gynecologist.
No way.
2-3 years ago, we had a cancer crisis in this country because there were not enough oncologists. Or the
Really?
waiting line to get cancer treatment in public healthcare was so long that people were actually dying while waiting for chemotherapy or radiation. Or also the idea of we don't love our vaginas, or we don't know our vaginas enough to love them. So even the idea of going for a pap smear, the myths and the fears around being in stirrups, somebody taking that sample, a healthcare professional taking that sample, is something that scares a lot of women.
Well, it does. It does. I'm glad that you brought up the whole subject around pap smears, right? It's something that's very important that women need to, put on a priority list. Get your pap smear. But could there be more apart from just fears of getting a pap smear?
Lack of awareness and knowledge. Parents are told, and we'll talk about this a little bit later, to get their daughters to get the HPV vaccine, but it's not explained what the vaccine is supposed to do. And I'm talking to people with degrees, well-educated people who don't want to do it. Not because they are, this idea that they don't know enough, but because it's not explained. People are the fear comes from a lack of knowledge, not knowing that, if I do this. But I think for the majority of South African women or people with uteruses and cervixes, the problem lies with access.
Access.
In public healthcare particularly. We have private pharmacies during Cervical Cancer Month that have specials where you can get a pap smear for even about 300 Rand. But like I was saying with the Mpumalanga gynecology issue, where there is no access. People go to their local health facilities, their clinics, their community healthcare centers, and they cannot get that. The nurse or the healthcare worker is not asking you, hey, have you heard about cervical cancer? Have you heard about a pap smear?
They're not putting the information
lack
out
of
there.
Integration of services.
Of services.
So when I come in as a patient into a clinic, I'm not seen as like a full human being. Do we have integrated services where our clinics, which are called primary healthcare facilities, are a one-stop shop?
Yeah.
And then imagine you live in a rural area. I'll talk about the village I come from. I was raised in Muruleng, where a taxi to your closest clinic is maybe 10, 20 Rand. With our unemployment rates, where do we expect a 25-year-old unemployed who's in a village somewhere to afford 20 Rand to go to the clinic once, 2 times, or 3 times in a space of a month for these different healthcare reasons? So it's
layered.
It's so layered.
It's layered. I want to talk about the importance of getting a pap smear. Why is it so important to get a pap smear? I mean, acknowledging all these difficulties, we can't pretend like they don't exist and people aren't affected by these difficulties, but why is it so important? Why is it imperative for us to get a pap smear?
So it's important because that's when, if you have cancerous lesions or lesions that may cause cancer, that's when they're detected before they become cervical cancer.
Yes.
And so for me, I was always scared of getting a pap smear as well. But it's now a ritual. I get it every March, every year before the end of March. I've had my pap smear because the sooner you detect those possibly cancerous lesions, the sooner you are to prevent cervical cancer. And that's why it's important, prevention.
Prevention,
Yes.
always prevention. Portia, you are a survivor of cervical cancer, Thokoza. Did you know all of this information prior being diagnosed with cervical cancer?
No, I didn't know. But there was a time I decided to go to the clinic. I was not ill by that time, just wanted to check. And I went to the clinic, asked for Pap smear, and then sister, what is the reason for you to do that? Ngathi mina, I don't have a reason. But no, you can't do Pap smear.
Do you see this though?
Wow.
Do you see
Ngathi
this?
mina, angisho mau sexually active, you have to do it.
Mele uzitlhokomele.
Yeah. So yena, she gave me the reason not to do Pap smear because I don't have a reason.
Wow.
And later, maybe a few months later, I started to have cervical cancer.
Ne di jwang di-signs tsa cervical cancer mmele no reng?
I had a back pain, swollen legs, STI, unusual discharge, brownish, and
Nenga.
yeah, and it has blood. And then I went to the doctor. The doctor said to me, you can't do Pap smear while you are still bleeding. And then he gave me pills to stop the bleeding. And then it stopped. After maybe 3 months, I went back and I did my Pap smear. It came positive.
Sure.
I had cervical cancer. I tested 3-4 times. I wanted to be sure. And then by that time, I was losing weight.
Ho affecta.
Yeah.
Kana koe o kry-a diagnosis ya hao no sa tshoga?
Ne ke tshogile.
O nahanang ka nako?
Cancer. Ke nagana gore cancer ya bolaya.
Ke
tlo shwa.
o be o treata bjang? Ba o file treatment e jwang?
Ba nkisitse for chemotherapy. And then after, I did chemotherapy 6 months only. And then that was it. I was healed.
Chemotherapy yakho ibinzima? Was it
Kakhulu.
taxing on the body?
Yeah.
Yeah, njani?
I was vomiting all the time, loss of hair.
Yeah, of course.
My skin was like,
Sagging and peeling.
yeah. And then I had abdominal pains. Yes.
So
And I was still bleeding more.
and more still while you were on the chemotherapy.
Yes.
So you were really, really challenged
Yeah,
physically.
and I was so thin. I lost so much weight.
Support nona lona?
Tata from my family. My mother, my father, my daughter, my sisters, everybody. Especially at home.
Yeah.
Negele depressed. I was so depressed until 2016,
O find out learning.
2008. So Gensika depression for a very, very long time.
It's very challenging. It's very, very challenging. And I find it very disappointing, Dr. Travill, that, you know, one would visit a state institute, a medical institute, right? Like a clinic, and want to do a Pap smear. And you're told, well, you can't get a Pap smear because you don't have a reason to get a Pap smear. I mean, my reason to get a Pap smear is to get a Pap smear.
Yes.
Hello? Why do we need more reason than that to get a Pap smear? Why are there so many barriers for females to just walk in and get the service that they need for their health and get a diagnosis? I mean, the earlier we get a diagnosis, the better.
Yes.
Dr. Travill, you can have a Pap smear, a free Pap smear every 10 years, right? And that's policy in SA. How often is it recommended for one to get a Pap smear?
So the new guidelines that came out last month, the guidance is different for HIV positive and HIV negative women. Our current guidelines around Pap smears are for HIV negative women from the age of 30 to get one every 10 years. And for HIV positive women starting from the age of 25 off, or from the date of diagnosis, every 3 to 5 years. And that is if there are no problems. That's purely as a screening test. If you have any symptoms or any problems, then we would do a Pap smear earlier on.
That's very interesting that you're mentioning those new guidelines, because in a conversation that I had with Portia, she had said that at the clinic they advise every year, you said, isn't it?
Every year.
Every year get a Pap smear.
Yes.
So is this necessary to go for a Pap smear every year based on these new guidelines?
So it depends. I think if you have had an abnormal Pap smear, then yes, you go more frequently afterwards. If you've had completely normal Pap smears, the science kind of guides us to say that it's not necessary to go that frequently, because the likelihood of a change in that short period of time is unlikely. But if there are concerns, then obviously more frequently is better. And again, this is a public health message. So this is what is the best for most. This is the message that we put out there. And I think the reason that that's so important is because if we look at the data, 80% of women who have cervical cancer have never had a Pap smear before until they were diagnosed. And so that's the big gap, is that people aren't even accessing. And we know that even getting 2 Pap smears in your lifetime reduces your risk of cervical cancer. And so I think the challenge at the moment is getting people in for screening. The frequency of screening, I think you can deal with on a case-by-case basis. The message to the population is, we want you to get the screening from the age of 30 every 5 to 10 years, because that will reduce your risk.
So Dr. Travill, with the South African healthcare system, right, you can get free Pap smears, isn't it? Now, with the knowledge that you can get free Pap smears, why is it that still so many Black women, Black females, Black persons with uteruses are dying from cervical cancer?
So I think that's an incredibly important question. And I think we have to take a really wide look at this. So first of all, yes, all primary healthcare services are free, including Pap smears. And so anyone can go into a primary healthcare facility and receive their Pap smears. I think that, cervical cancer is a disease of inequality, and we see that at a global level, not just within South Africa. Poorer countries, poorer resource countries are much more affected by cervical cancer. And in South Africa, Black and colored populations are disproportionately affected by cervical cancer. So for me, HPV and cervical cancer gives us a really good perspective of a healthcare system, because there's so many components and kind of steps along the way, from HPV acquisition, which we now have a vaccination program for, so how well their vaccination program's working, to our screening interventions, which is targeted to kind of pick up the problem before it's a problem, to how we manage and treat cervical cancer. And so I think that each part of that we are having challenges in, and that we are working on. I think it's important getting the information out there. Then you make the decision to go and get the Pap smear. There might be a delay in results coming out, getting people to come back to the clinic just to get their results. Now we've got the screening results, and we have to then refer people for further treatment to tertiary or secondary services to go and see a specialist. So there may be a delay in that referral time. Then can you access the treatment options? Are those available? And so I think it's each kind of step of the way. There's a little bit of small challenges that then mount up and make this really big challenge.
Portia, your experience, this was pretty much what you've experienced, ne?
Yeah, most of the time go ho tsena ko di clinic o tlo ira Pap smear. Basadi, they don't respect basadi ba bang. How are you going to open your legs whilst there are movements? Kuyangenwa kuyaphunywa. Kuvula umnyango, kubusy. Uloku hlezi. So how are you going to go back and do Pap smear there? So
this adds to those fears, no?
Yes, that's why abafazi abaningi angeke baye lapho. Especially ngoba siyazi ukuthi vele ema clinic ama government clinic and hospitals siyayazi ukuthi treatment yakhona injani. Irof. So imagine ibe rofo ukufika lapho where they don't respect your private parts. It's painful.
You experienced that?
I did. A lot of times. Yeah, bo. I did. That's why most of the time I was so unhappy. Because I have to go back there and get my treatment there.
And the thing is, you're dealing with so much. I mean, you're dealing with, being told that these are the conditions you're now living with. And, you've got this, you've got that, you've got this, you've got that on top of that. You've got an emotional breakdown. You've got this depression that you're dealing with. I want to talk to you about destigmatizing HPV and also why women don't feel comfortable talking about cervical cancer. We have to destigmatize HPV as an STI. Why is there such a big stigma there?
Again, it's vaginas. When we talk about vaginas in a sexual way, there's no stigma.
I was about to say that.
When we talk about men or people using our vaginas for their entertainment and pleasure,
absolutely, there's no stigma. But when we talk about
public health, particularly for women, there is now this stigma. I think one thing that is important is to realize that patriarchy is not men are not the only vehicles of exercising patriarchy. As women, we can also be vehicles of patriarchy because that is just how oppression works. So when I talk about patriarchy, I'm not saying that men are preventing us from knowing and learning about it, but I'm talking about the systemic patriarchal nature of our society. The fact that when Gogo Portia went to a clinic, they told her she has to have a reason
to have a Pap smear.
To have a Pap smear. If a man came in and said, "I want my prostate checked," no one's going to ask that man why he needs his prostate checked. Or if he comes in and says, "I think something is medically wrong with my penis." Right? And so that's in the context of patriarchy that I'm talking about.
I get you.
But we do need to educate people. I do not think, going into communities with the work that I do, asking parents, particularly with the HPV vaccine, would you let your daughter get the HPV vaccine? A lot of parents are saying no. And they're not saying no with the right knowledge. They're saying no because they think this is trying to force contraceptives on my children. They don't understand why the HPV vaccine. So government has the responsibility constitutionally and socially and legally, to be quite honest, to make sure that society understands why it is important to get the HPV vaccine. So the program that we saw the National Health Department do through schools, to empowering teachers to understand so that they can transfer that knowledge to parents and to the SGB. That's something great, and we need more of that work.
Absolutely.
So that we see young girls particularly getting the vaccine more.
I'm going to throw this to you, Dr. Travill. We're talking more about the vaccine. This is what you do. This is your work. I know that there's a big project that you're involved in with the rollout of the HPV vaccine. Would you agree that a lot of parents are saying nooit to their daughters being exposed to the vaccine or having the vaccine administered on them on the basis that it is associated to an STI?
I think it's complicated, and I think there's many reasons that there's vaccine hesitancy. I do think we need to get more information out there about it, and I've heard a lot of nurses referring to it as the cancer vaccine rather than the HPV vaccine because they found that was a lot more acceptable. I think the second thing is this, does this actually concern me? Is this a problem for me? Like, do I need this vaccine? And that is really hard because we're saying to parents, your 9-year-old, we want to vaccinate them now before they're exposed. And we know that they're probably going to be exposed whenever their sexual debut is because it's so common. We want to prevent them before their sexual debut so that they're not exposed to HPV for the cervical cancer that they might get in 30 years. Now that's really, it's a big ask to put that all together to explain that risk to a parent about their child. And so we need to do a better job about that. We need to be able to make that information tangible and accessible to people to explain the reason we're doing it now is because this is where we have the biggest impact, that this is the optimal age for us to give it to. And then the last thing is access. Is it easy for people to access that? And we're seeing that with for example, Pap smears, it's not easy for people to access. Distributing it in schools, that's really good access. And so we're running a study over 5 years that will only finish in a few years' time to look at this. And then a really important part of the study is also to look at an HIV positive population. How well does this vaccine work in an HIV positive population? And also, is one dose enough for them, which is incredibly important in our context. We want to make sure that when we make interventions available, that they're available for all and effective for all.
Dr. Travill, the research around the HPV vaccine spans out 10 years, right? Why should people trust the HPV vaccine?
So this vaccine has been around for a really, really long time. There are countries that have implemented the vaccine many years ago. We have decades worth of science kind of supporting that it's effective and that it's safe. And it's been approved by all regulatory bodies. Most of the vaccines are approved in over 100 countries. And so these are countries that have themselves looked at the data and said, this works and this is safe.
Portia, when as a mother, right? How does this sound to your ears? Because you have a daughter, next generation daughter, right? Would you expose her? Not even would you expose her, but how would you teach her from your experience?
Mina nomntanam sinobudlelwane obuhle. I tell her everything. She knows about these diseases and what not to do and what to do.
Does she know about your personal experiences
Yes.
as well? Every detail?
Yeah, even about my HIV status, she knows. She always reminds me, did you take your medicine? Did you do?
Wow.
How old is she?
She's 27.
Yeah.
Yes.
Umkhulisi.
So I tell her everything. We talk about everything.
Have you educated her on Pap smears? Do you guys also talk about Pap smears?
Yes, we do.
If you knew about the HPV vaccine back then, would you have allowed your daughter to administer it?
Yes, I would. I want her to be happy, to be safe.
Yeah.
I don't want her to be like me, like the way I was depressed. It's not nice to be depressed every day of your life. Every day when you wake up, you are crying. Every day, every morning when you are crying. It's not nice. So I don't want that for her.
So, Dr. Travill, I stumbled upon some information that if you're already sexually active and above the age of 25, the vaccine isn't as effective on you. Is this true or false?
Basically, the vaccine is really targeted for people before they're sexually active, before their sexual debut. And that's because we know that after your sexual debut, your risk of HPV is really, really high. And, prevalence studies show us that 2 in 3 young women have been exposed to HPV or have an HPV infection.
Yeah.
And so we really want to target this vaccine to people before their sexual debut and get in there before they have any exposure to HPV. So it's really recommended from 9 to 15-year-olds. And we're getting in there at 9-year-olds in South Africa, which I think is fantastic. And then there's some data to support use in 15 to 25-year-olds in catch-up in people who have not yet had their sexual debut. But really, we want to get people before they've had their sexual debut because this protects you from HPV. So you really want to have the vaccine in your body before any HPV exposure. And we just don't know after sexual debut whether or not you've been exposed.
Makes a lot of sense. So what then is available for those that are sexually active and above the age of 25? Raising my hand here for self as well.
So I think as Portia explained her journey so beautifully, I think that in conjunction with vaccination, we need to have an effective screening program, whether that be Pap smears or HPV testing, whichever way we decide to go moving forward. And so I would strongly encourage women out there who are concerned to go and get a Pap smear, to go and get a screen. The only way we will overcome this is if we can act, and the only way we can act is if we know. And so going to get screened so that we can intervene before it becomes cancer, because there's things we can do to prevent the cancer from developing. And we want to be able to act at that point because it's easier, it's less traumatic, it has less impact on your mental health, it has a less burden on the public healthcare system for everyone involved. And I think just, shows like this where we provide people with information so that people know what their options are and can advocate for themselves is really important. I think especially having someone like Portia share her experience so that people can identify and see how this isn't something that's hidden away. This is happening to people around us. And this is something that we can really act on is more valuable than any kind of public health pamphlet probably is.
Well, absolutely. That's a very wholesome answer. I don't think any of us could have asked for a better answer. With that said, and on that note, while the spotlight is still on you, Dr. Travill, is there any key take-home that you want people at home to kind of hold on to as a parting thought?
Cervical cancer is preventable, and it is disproportionately affecting low and middle income countries. And in South Africa, it's disproportionately affecting Black women. And I think there are interventions that we as healthcare providers, as policymakers, as advocates need to take. And that includes a really strong vaccination campaign. And that includes educating children, but also their parents. And then having a really strong, robust screening system so that we can pick this up early, so that we are not treating cervical cancer, that we're preventing it.
Thank you very much. Thank you so much for that. Cervical cancer is preventable.
Yeah.
I think this is a message that will be driven on our Lil-Lets Talk community.
Yes.
And it's important that, we in our personal circles and in our personal communities, in the safe space of our friendships and in our homes with our children, male or female, we talk about this. We need to teach our sons, we need to teach our daughters, because at the end of the day, the future is theirs and we don't really want to damage them because we've denied them information. Portia, your parting thoughts, any key point that you feel abantu basekhaya that are watching right now need to know and need to hold on to those words for dear life?
Kere basadi, let's go out there and check ourselves, our health. Akusimnandi ukugula. Akusimnandi ukuya ku-chemotherapy every day. It's not fun. So I say go out there and do your pap smear no matter what. Let's teach our young girls ukuthi imzimba yethu sinaketsela kanjani. Thokozani ngiyabonga.
Thokoza gogo, thokoza sibonge. Pontsho, floor's yours.
You know, I know you said one key takeaway, but I have two. I'm going to be naughty.
Absolutely. That's why we have this sense of community.
Yeah,
it's important.
And I think the first one is really it's a call to action for our government to really prioritize awareness campaigns, communication campaigns in different languages on different platforms, that it's not just Lil-Lets Talk that is actually talking about this, to inform parents, to inform schools, and have drives in schools around explaining the importance of the HPV vaccine. And I think the second one is really to, as a collective, as women, as people with uteruses, to become advocates for ourselves and each other. You know, it's like very hard to stand up for yourself. I'm very outspoken, but when I have to confront someone, I cry. I'm a crybaby, and I can imagine what it feels like to be in a facility, and this is your only access to care, and it's in your community as well. You don't want people knowing your business, but we need to learn to advocate for ourselves and each other. If you're in a clinic line and you hear a nurse say no to someone, say you can't get a pap smear here, or no, we don't have the equipment to do pap smears, call your local, your premier, you know, bug those for, like, really talk to the councillors in local municipalities to really make this an issue for everyone, because it's not just, yes, the burden is falling on us as people with cervixes and uteruses, but it is the collective well-being of society, particularly because women hold the society together. And if women are sick, particularly at that age, that at an older age, it means that younger kids are not being taken care of, the economy, you know, and so I think that's the ripple effect. The ripple effect is massive, and that it's not just a women's issue.
Well, thank you very much to all of you ladies. Dr. Travill, Portia, Pontsho, thank you so much. Really appreciate it. And I would encourage everyone, you know, to further discuss this on lil-letstalk.co.za. The community is there for a reason. You know, this is why it's important to have these conversations on such safe platforms. And for myself, really, thank you so much for being brave enough, Gogo, to talk to us about, you know, your experience and your journey and trusting us with your story. We appreciate that a ton lots. Thank you, ladies.
Thank you.